Hello. In this presentation on lymph nodes and lymphatic drainage, we shall be looking at the organization of lymphoid organs in the human body, and we shall discuss the structure and organization of lymph nodes in the head and neck region and discuss the functions of the lymph nodes. And finally, we shall look at uh, the drainage pathways for the lymph nodes, and towards the very end we shall discuss some of the common causes of lymph node enlargement in the head and neck region. The lymphoid organs in the human body are classified as primary and secondary lymphoid organs. The primary lymphoid organs, also known as central lymphoid organs, are responsible for the production of lymphocytes from immature progenitor cells, and these include the thymus and the bone marrow. The secondary lymphoid organs, also known as peripheral lymphoid organs, they are responsible for maintaining mature lymphocytes and initiate an immune response in response to various pathogens. And as a result, mature lymphocytes are able to recirculate between the blood and the peripheral lymphoid organs. The peripheral lymphoid organs include the lymph nodes, tonsils, spleen, and lymphoid tissue associated with mucosa, bronchi, and the gut. Lymph nodes are small lentil-sized bean-shaped structures situated along the course of the collecting lymph vessels, and they contain lymphocytes, macrophages, and reticular cells. And we shall look at the structure of the lymph node in a bit more detail in the next slide. As mentioned in the previous slide, lymph nodes are bean-shaped or kidney-shaped structures and consists of an outer cortex and an inner medulla, and you can also see afferent and efferent blood vessels uh, which are responsible for drainage of lymph fluid. The B lymphocytes are mainly concentrated in the outer cortex where they form the lymphoid follicles, whereas the T lymphocytes are mainly seen in the paracortical areas or the deep cortex. Macrophages are scattered throughout the lymphoid tissue, and finally the plasma cells, which will ultimately form the immunoglobulins, are mostly found in the medullary cords. The lymph fluid has several functions, including removal of interstitial fluid from the tissues, transport of white blood cells to and from the lymph nodes into the bones, and transport of antigen presenting cells or APCs to the lymph nodes where an immune response is stimulated. Finally, the lymph fluid is involved in the absorption and transports of fats as chyle from the gastrointestinal tract. The lymph nodes in the head and neck region are arranged in three chains. First is the superficial circular chain, which is a group of superficial nodes which extend from the chin to the occiput, that is around the junction of the head and neck. Then you have a vertical chain, which is often referred to as deep cervical lymph nodes, which are arranged along the internal jugular vein from the digastric muscle to the root of the neck. And finally, there is a deep circular chain which includes groups of lymph nodes which surround the upper airways and the alimentary passages. Now, before discussing the individual groups of lymph nodes in the head and neck region, it would be useful to revisit the triangles of the neck to orient us with the organization of lymph nodes in the head and neck region. Now, as you might know, that the neck is divided into anterior and posterior triangles on either side. So starting with the anterior triangle, superiorly you have the submental triangle located between the two anterior bellies of the digastric muscle and the base at the hyoid bone, and the apex is at the chin. The submandibular triangle is located along the lower border of the mandible and is bounded anteriorly by the anterior belly of the digastric muscle and posteriorly by the posterior belly of the digastric muscle. Then you have the carotid triangle bounded superiorly by the posterior belly of the digastric muscle and inferiorly by the superior belly of the omohyoid muscle. Further laterally you have the anterior border of the sternomastoid muscle, which also forms the base of the carotid triangle, and it contains the carotid vessels and the internal jugular vein. And then finally you have the muscular triangle, which is located along the lower part of the anterior border of the sternomastoid muscle, and further superiorly you have the superior belly of the omohyoid muscle, and the muscular triangle merges with the counterpart on the opposite side. Then you have the posterior triangle of the neck bounded by the posterior border of the sternomastoid muscle anteriorly and the trapezius muscle posteriorly. It has two components: the occipital triangle between the trapezius muscle and the inferior belly of the omohyoid muscle. And finally you have the supraclavicular triangle between the clavicle and the inferior belly of the omohyoid muscle. So this image depicts the three different groups of lymph nodes, starting with the superficial circular chain, the submental, the submandibular, the buccal, the preauricular, parotid, postauricular and occipital group of lymph nodes. Then is the superficial vertical chain, which is arranged along the internal jugular vein, parallel to the sternocleidomastoid muscle. These groups of lymph nodes are referred to as the deep cervical lymph nodes. And finally, the deep circular groups of lymph nodes, which are related to the upper airways, the prelaryngeal and pharyngeal groups of lymph nodes, including the lateral pharyngeal and the retropharyngeal groups of lymph nodes. Now we can discuss the individual groups of lymph nodes in a bit more detail, starting with the superficial circular chain. First, we have the submental group of lymph nodes, which lie in the submental triangle underneath the chin between the anterior bellies of digastric muscle. And the submental group of lymph nodes, they drain the apex of the tongue, the anterior part of the oral floor, the anterior mandibular ridge and the lower lip, and they ultimately drain into the submandibular and superior deep cervical lymph nodes. The submandibular group of lymph nodes lie on the surface of the submandibular gland beneath the investing layer of deep cervical fascia, and they are responsible for draining the face, the anterior and lateral part of the nose, the anterior two-thirds of the tongue, oral floor, the lateral part of the lower lip, as well as the frontal, maxillary and ethmoidal air sinuses. And along with the submandibular lymph nodes, there are scattered lymph nodes in the buccal, buccinator and infraorbital regions, and these also drain into the submandibular group of lymph nodes. The submandibular group of lymph nodes ultimately empty into the superior deep cervical lymph nodes. Then you have the parotid group of lymph nodes, which consists of superficial and deep groups. The superficial parotid lymph nodes lie lateral to the parotid gland and drain the forehead, temple, eyelids, and external ear, whereas the deep group lies within the substance of the parotid gland and drains the eyelid and middle ear. The parotid group of lymph nodes empty into the superior deep cervical lymph nodes. Then the fourth group in the superficial cervical circular chain is the auricular group of lymph nodes consisting of anterior auricular and posterior auricular lymph nodes. The anterior group lies anterior to the tragus and drains skin adjacent to the ear and temporal regions, and these empty into superior deep cervical lymph nodes. The posterior auricular or post-auricular group of lymph nodes lies superficial to the attachment of the sternocleidomastoid muscle on the mastoid process and drain the posterior part of the temporoparietal region, the upper part of the external ear, and the back of the external acoustic meatus, and they also empty into the deep cervical lymph nodes. And finally, the last group in the superficial circular group of lymph nodes is the occipital group of lymph nodes, which lie at the apex of the posterior triangle of the neck and drain the occipital region of the scalp and empty into the deep cervical lymph nodes. Next, we can look at the vertical group of lymph nodes or the deep cervical lymph nodes, which form a chain along the carotid sheath lying by the side of the pharynx, esophagus, trachea, extending from the base of the skull all the way down to the root of the neck. And there are two main recognized groups: the superior group, which lie in the anterior triangle, and the inferior group, which lie in the posterior triangle. The superior group of deep cervical lymph nodes is also known as the anterosuperior group, and they lie underneath the anterior border of the sternomastoid muscle in close relationship to the accessory nerve and the internal jugular vein. The superior group drains the occipital portion of the scalp, the back of the neck, tongue, the larynx, thyroid gland, trachea, nasal part of the pharynx, nasal cavities, palate, esophagus, and also receives efferents from other nodes from the head and neck region. And all the submandibular groups of lymph nodes ultimately drain into the superior group of deep cervical lymph nodes. The inferior group of deep cervical lymph nodes, also known as the postero-inferior group of deep cervical lymph nodes, they extend beyond the posterior margin of the sternocleidomastoid muscle in the supraclavicular triangle, where they are closely related to the brachial plexus and subclavian vein, and they drain the back part of the scalp and the neck, the superficial pectoral region, part of the arm, and vessels from the superior deep cervical glands. Just a few words about the lymphatic drainage of the tongue. As you might know that the tongue is the commonest site for intraoral squamous cell carcinoma. In order to understand lymph node metastasis from tongue cancer, uh, we need to revisit the lymphatic drainage of the tongue. So the apex of the tongue, as we've discussed previously, drains into the submental group of lymph nodes, which in turn drain into the submandibular, and the submandibular drain into the superior deep cervical lymph nodes. The lateral borders of the tongue drain into the ipsilateral submandibular lymph nodes. Similarly, the posterior third of the tongue drains into the superior deep cervical lymph nodes. However, it is important to note that the central part of the tongue, the lymphatic drainage, can go to the contralateral side, which then means that lingual carcinomas can not only spread to ipsilateral deep cervical lymph nodes, but they could also metastasize to contralateral deep cervical lymph nodes. Finally, the deep cervical lymph nodes in the circular chain surround the larynx, trachea, and pharynx and include the pretracheal lymph nodes, which drain part of the lower larynx, trachea, and thyroid isthmus, and the retropharyngeal group of lymph nodes, which drain the soft palate, the posterior part of the hard palate, nose, pharynx, sphenoidal, and posterior ethmoidal sinuses. These also ultimately drain into the superior deep cervical lymph nodes. And similarly, there are paratracheal lymph nodes which drain the uh, trachea and the adjacent tissues. The Welders tonsillar ring refers to a collection of lymphatic tissue surrounding the upper pharynx, and it responds to pathogens which may be ingested or inhaled. The Welders tonsillar ring includes four groups of tonsils: the lingual tonsil in the posterior base of the tongue, the palatine tonsils, which are bilateral and located between the palatoglossal and palatopharyngeal arches on either side, the tubal tonsils adjacent to the opening of the eustachian tubes, and again they are bilateral, and finally the pharyngeal tonsil, also referred to as adenoids, which is present in the roof of the nasopharynx. The lymph fluid from the left side of the body empties into the thoracic duct, which ultimately drains into the junction of the left internal jugular and left subclavian veins. On the right side, you have the lymphatic duct, which also empties at the junction of the right internal jugular and subclavian veins. The internal jugular and subclavian veins in turn join to form the brachiocephalic veins at the root of the neck above the first rib. So you have the right brachiocephalic vein and the left brachiocephalic vein, which pass behind the manubrium sterni to form the superior vena cava, which drains into the right atrium. So this image depicts the main groups of lymph nodes in the superficial circular chain and the deep vertical chain. Starting anteriorly underneath the chin, you have the submental, the submandibular, buccal, infraorbital, buccinator, preauricular, parotid, postauricular, and occipital group of lymph nodes. And then you have the vertical chain, which includes the anterosuperior group and the posterior-inferior group. Lymphadenopathy refers to enlarged lymph nodes secondary to a pathology. The main causes of lymphadenopathy include infections such as bacterial, viral, fungal, and protozoal infections, malignancies of the lymphoid organs such as lymphomas, and secondary malignancies involving the lymph nodes as a result of metastasis. And then there are certain metabolic disorders and idiopathic disorders which may be associated with lymphadenopathy. Um, One of the most recognized causes of cervical lymphadenopathy secondary to infections is related to tuberculosis. So tuberculous lymphadenopathy is commonly observed in countries where tuberculosis is endemic, particularly the underdeveloped countries in Asia and Africa. Metastasis from oral squamous cell carcinoma to cervical lymph nodes constitutes one of the more important causes of cervical lymphadenopathy in the head and neck region, which is of concern. Surgical management of oral squamous cell carcinoma involves resection of the primary tumor along with removal of the lymph nodes in the neck, uh, and three structures are at risk during lymph node dissection, including the jugular vein, the sternomastoid muscle, and the accessory nerve, and one or more of these structures may need to be sacrificed during lymph node dissection of the neck. Vercos node, named after a German pathologist, is an enlarged lymph node in the left supraclavicular fossa and indicates metastasis from gastric cancer, and this is known as the Trousseau's sign. During clinical examination of enlarged lymph nodes, you should note the site, whether the enlarged lymph node is in the submandibular region, submental region, preauricular region, or um, the deep cervical chain, and also note uh, whether the lymph node enlargement is unilateral or bilateral. Note its size, consistency, whether they are soft, firm, or hard. Also note relationship to the skin and underlying structures. If the lymph nodes are uh, fixed to the overlying skin or underlying muscles, then it is likely to indicate uh, a malignant lesion. Also note whether the lymph nodes are tender on palpation. Soft, tender lymph nodes often indicate acute infection, whereas non-tender lymph nodes uh, might appear to be uh, less of a concern, but in reality, uh, most malignant lymph nodes are initially non-tender. Also note uh, changes in the local tissues secondary to inflammation. Notice any discharge from the lymph nodes and any local nerve dysfunction. And following clinical examination, you would determine whether it warrants further investigations through fine needle aspiration cytology, ultrasonography, or MRI. In summary, you should develop an understanding of the structure, function, and organization of lymph nodes in the head and neck region, and you should be able to recognize common causes of lymph node enlargement and their clinical presentation for specialist referral as and when indicated. And these are two of the recommended textbooks for further reading: Anatomy for Dental Students by Johnson and Moore, and Netter's Head and Neck Anatomy for Dentistry. Thank you.